Welcome to our webinar on the aging face. I'm Dr. Brian Rubach, Director for the Center for Cosmetic and Laser Surgery. I have over 30 years experience specialized in facial plastic surgery. We're going to be presenting videos on the different treatment options for facial aging. And following this, we will have a live question and answer session. Please enjoy. One of the most important questions that I get asked during a consultation is, how can I address my facial aging but keep things natural? I take great pride in understanding how the facial aging occurs and how to address that in a natural way. I look at addressing facial aging more as restorative, not with changing the facial structure. I'd like to see my patients look younger, more youthful, energetic, which matches the way they feel internally. What we'll be doing is describing some of the different techniques to address facial aging in the next set of videos. The deep plane technique frees up ligaments that fix the soft tissues of the midface and the neck in place. Without freeing this up, it's not able to be achieved to restore the normal position of the facial soft tissues. People are concerned about an unnatural appearance. Well, there's several reasons for that. One is that if these deep plane ligaments are not freed, we cannot free the cheek and lift into the natural position where it started. Secondarily, if we don't free these ligaments here, we tighten and it creates a swept look to the face. The other thing about facial aging is it occurs down and inward, and the vector of lifting is up and outward back to the original position. When you see unnatural looks, it's because the face has been pulled back in a horizontal plane. That is not how we age, and that results in unnatural results following the procedure. As I had mentioned before, the other piece of this is volume. So if we look at an aging face, someone in their late 60s, 70s, 80s, the face becomes very skeletal. So what happens is you start to see the outline of the underlying facial skeleton. A youthful cheek has a nice, full, smooth contour. As we age, we lose this volume in the buccal space, as well as the upper midface. And what results is a look of a skeletal appearance. So simply lifting does not complete the picture to achieve a natural result. What do I use for volume, return of volume to the face? I use a patient's fat. So we liposuction fat from around the belly button. We process that fat, and then we re-inject it into the areas to achieve a restored natural contour. Another frequently asked question is, what is a facelift procedure entail? We do our surgery in our own surgery center in office. Our surgery center is Joint Commission accredited. And we do the procedure under twilight, which means IV sedation. The advantage of that is that people wake up much quicker, are able to leave the office and get home quicker, and the incidence of nausea and vomiting is minimal as compared to a general anesthetic. Now, the recovery involves the first night a compression dressing on the face with a drain. Typically, there's not a lot of pain, at least in my hands, with this procedure. The most difficult portion is the first night because there is a tight compression dressing. That comes off the following day along with the drain. We wash the patient's hair in the office, and the patient has to take it easy for 1 week, which means no significant physical activity, not out driving around or doing errands or other things. That makes a big difference in the recovery because it minimizes swelling. Patients come back at day 7 and day 10 after the procedure to have their sutures out. Typically, patients are able to return to social activities within 10 to 14 days, depending on bruising. I really look at healing in 2 phases. The first is bruising and swelling to be able to resume social activities, 10 to 14 days. Following that is the long-term healing. Long-term healing is maturing of the incisions from pink to skin color. This surgical area is typically somewhat numb, and the nerve endings need to reestablish themselves. And the soft tissues during healing can be firm. This takes anywhere from 8 to 12 weeks for that to occur. Following the 12-week period, patients feel the same as they did before. Soft tissues feel normal sensation. Patients are able to return to normal activities. Typically, I don't want people doing any significant exercise for 3 weeks from the date of the procedure, and then they can gradually advance activity as tolerated. It is very common, along with the facelift procedure, to address aging of the upper and lower eyelid. The first thing to understand is how the eyelid region ages. The upper eyelid is 3-dimensionally related to the brow. As the brow drops, the upper eyelid skin becomes heavier. Along with that, the skin sags, and there is usually excess skin associated. Now, the upper eyelid, there are a lot of variations as to what we see in the upper eyelid anatomy. Some people have very heavy, full upper eyelids even when they're younger. Other people have very hollow upper lids. Depending on what we see at the consultation, recommendations are made regarding managing removing fat or not removing fat. We don't want to hollow out the upper eyelids because that also creates an unnatural result. In regard to the lower lid, there is also a 3-dimensional relationship. The cheek drops, and as it does, this begins to hollow the infraorbital area. The orbital fat begins to pooch forward, typically creating a bag, and the skin and muscle become relaxed and sag. So how do we address these changes? In the upper lid, we perform something called an upper lid blepharoplasty, which means a cosmetic procedure to improve the contour of the upper lid. That involves making an incision right in the lid fold, which is very difficult to visualize once healed. The excess skin and muscle are removed, and sometimes the fat is contoured depending on what we need to accomplish to achieve a natural result. In regard to the lower eyelid, a similar approach is unique for each individual, and that is that when there is bulging fat, the fat will be contoured so that it is smooth. If there is significant hollowing along the infraorbital rim, volume is placed to restore that smooth contour between the cheek and lid junction. And if there is laxity of the skin and muscle, then that is tightened and the excess skin is removed. Similar to the facelift, it's very important to understand each person's unique facial anatomy and tailor the appropriate treatment to achieve a natural result. Recovery from blepharoplasty depends on what procedure or procedures are done. For an upper lid blepharoplasty, there's an incision in the lid fold and a single suture that runs underneath the skin with a loop at the outside of the incision. That suture is in place for 1 week, and at the 1 week follow-up visit, the suture is removed, it slides out. The incision is well hidden. Depending on bruising, the recovery to resume social activities is anywhere from 7 to 10 days. In regard to the lower eyelid, there are 2 different ways that we approach this depending on what we see at the preoperative consult. The external incision, called a subciliary blepharoplasty, involves an incision just beneath the eyelashes, and there are sutures put in that also come out at 1 week. The alternative approach is something called the transconjunctival approach, where there is no external incision. There are no sutures to remove for that procedure. How do we differentiate between a subciliary or internal transconjunctival incision? It depends on whether or not there is significant laxity in the skin and muscle that requires tightening. As I said, with the subciliary approach, sutures are removed at 1 week. Typically, the recovery to resume social activities for the lower eyelid takes about 10 days. However, some people are able to return to normal social activities within a week. Overall, I tell my patients to anticipate 7 to 10 days of recovery for blepharoplasty. Another piece of addressing the aging face is addressing the cutaneous changes that occur with aging. Specifically, I'm frequently asked about the changes that occur around the mouth area, what we call the perioral region. Not only are there textural changes that occur, but very commonly there are lines that develop around the mouth area. Because this is in the skin, it requires us to treat the skin. The treatment options are laser. Now, the two different options within the laser treatment segment are CO2 or erbium. So I originally did the research 28 years ago for the CO2 laser to treat skin-related problems. I used the CO2 laser for approximately 6 years, but changed over to the erbium laser following that. The reason I changed from the CO2 laser is the CO2 laser imparts a significant amount of collateral thermal injury into the deeper skin as it's being treated. What this means is longer recovery, as well as the potential for what we call hypopigmentation or permanent lightening of the skin. Since I changed over to the erbium laser, I have not seen that. So what do I do with the erbium laser? The erbium laser is an incredibly precise way to remove the outer damaged layers of the skin, allowing new healthy skin to grow in place of the damaged skin. It's highly effective. It not only treats wrinkles, but it also treats the textural changes, and very often it is done in conjunction with a facelift to create a harmonious balance to the result following a facelift. Laser resurfacing recovery requires some patient engagement to manage and take care of the skin as it's healing. For the first week, the skin needs to be covered with Aquaphor at all times to keep it moist. This promotes healthy healing. It also decreases any discomfort. Following the laser procedure, there's initially a sunburn burning sensation, which lasts 20 to 30 minutes. After that, provided that the skin is covered with Aquaphor, there really is no discomfort. After 1 week, the skin is typically healed on the surface, and makeup can be worn to cover up the redness that is present. Typically, there is redness, or what we call erythema, that lasts anywhere from 6 to 8 weeks and does require makeup to cover that up until the normal skin color returns. Thank you for attending our webinar on management of the aging face. I would encourage you to schedule a consultation. My consultation process involves first listening to what your concerns are. Second, giving you my evaluation of what I see and what the changes are. Third, presenting treatment options, both non-surgical and surgical. Setting expectations for the outcome. Part of that is computer imaging. We take a photograph of you in our photography studio, and then I use computer imaging to show you the potential results for the procedure. And lastly, is discussing costs for the procedure. If you schedule through this webinar by calling our office at 630-851-3223, there would be no charge for the consultation. Thank you again.